Hi everybody, this is Morgan Denny here today, and I'm going to talk about a topic that is near and dear to my heart, and that is treating patients with mental health issues. These are some of my favorite patients to treat for a variety of reasons. Number one, I think that most of these patients kind of get the shit end of the stick in society, as our society kind of tends to discount them and put them in a separate box, and I think that's inappropriate. Number two, because our society kind of puts them in this box, a lot of these patients are really undertreated, but I think also are very deserving of good physical therapy and good treatment and can benefit from it greatly. So today what I wanted to do is take some time and just give you guys a couple little tips on how to effectively and efficiently treat patients that have any type of mental or psychological problem. Obviously, this could be a really, really long talk. So my goal today is to keep it quick, and I created some bullet points for myself so that I wouldn't keep you guys here forever. Now, a lot of these tips and tricks, if you guys are thinking about it appropriately, are going to be really good for treating any patient in your clinic. However, I think that they're even more important for having success with patients with mental illness and issues like that. I also just saw the dog walk by in the background. Anybody else? That was weird. Anyhow, so number one, first and foremost, have compassion, right? These are real people that have real issues. And the second that you step outside the box and you show them that you understand that they have problems and you can understand that their experience is real and valid, you're going to create a better connection between the two of you as a patient and provider and kind of create an atmosphere of trust. This is key in any patient-provider relationship, but additionally is really, really important when dealing with people who are not necessarily as stable in their mental condition as the majority of your patients. Number two, be open and straightforward. A lot of these patients have kind of gotten beat around the bush with, like, people aren't straightforward with them because they're afraid to upset them. They're afraid to rock the boat too much because of their mental illness problem. But you need to be straightforward with these people and they will appreciate it greatly. So if you can kind of have that open atmosphere and give them the information that you're able to provide and give them feedback, they'll be super appreciative of that as well. On the flip side of that, make sure you joke and be silly when it's appropriate, right? Similarly to people not being able to kind of be straightforward with this group, other people are too serious because they feel like, I don't want to upset the boat, I don't want to joke about a serious element. But many of these people are in darker places. If you can be a little bit silly and joke with them, not only does it create a better patient rapport, but it can lighten the mood and it can make treatment better. I'll give you an example. One of my favorite all-time patients has Asperger's syndrome. And the first day that I met her, she came into the clinic with me, we walked into the treatment room, she shut the door behind me very assertively, looked me straight in the eye, like 6 inches away from my face, and said, I have Asperger's. Went on a 10-minute rant about what Asperger's was and how her communication style was, and then asked me straight up, can I treat her? You know, and so your instant reaction is, whoa, overwhelmed. But if you can be with these people, understand what they're telling you, and then continue to be lighthearted about it and still joke and be a human with them, it's very effective. This individual patient, I actually think, probably continues to come to see me probably 50% because I make her laugh and we have a good time, and 50% because then she actually feels better at the end. So remember, guys, if you can kind of keep it light while being efficient and effective with these patients, super handy and helpful. All right, the other thing that's great is if you can use your hands and manual therapy skills with patients with mental health problems, it can be very, very effective. Remember, these are the patients that a lot of people are afraid to touch or don't want to get in there because they don't know how the patient's going to react. Now, obviously, you don't want to do anything that makes you uncomfortable or that you're not sure about, but a lot of these patients are going to react very positively to manual therapy, even light stuff, because they need that human touch and because other providers have held back from giving it to them. So don't be afraid to get your hands on these patients and do some good manual therapy type techniques. It can be super effective, just as effective as with other patients, and maybe on a greater, more emotional level for these patients. Additionally, with emotions, you have to remember that if they come up, you have to allow them to just happen. So patients with some mental overlay or stuff are going to come in and have experiences that are affecting them, both physically and mentally combined within certain days. So if a patient comes in and they're feeling emotional, allowing that patient to vent a little bit to you, or at least acknowledging their emotions and why they're potentially having them, can be really, really helpful for the patient to just calm the nervous system down. Let things settle a little bit so that you can, again, kind of stabilize the situation and help them get through it and build on whatever you're treating them for in the clinic. Similarly, having stability with these patients is one of the key factors. So your demeanor needs to be consistent and stable. If you're providing that atmosphere of stability, that's going to really help them not only know what to expect, but be able to know how to react in the situation. If people come in with mental health problems and you're reacting differently to them on day 1 versus day 2, they're going to start to doubt you and doubt your trust, right? So you're going to need to build that rapport no matter what's happening in your life. You need to make sure to create a stable and consistent situation for these people. It will really, really help them to be able to loosen up and also to share more with you or feel more comfortable in your care and your treatment style. Now, the other thing with that is that you have to remember not to take things personally, right? Just say no to ego. These patients are going to come in some days and they're going to be having bad days, and it has nothing to do with you, and it has nothing to do with the care that you're providing them. You might be giving them the utmost best care and they can still be having a bad day, and it's not your fault. It's not their fault either. What you should do on days that they come in and they're having a bad day is remember that they are letting you see them at what is potentially not their best. So that's a compliment to you, right? They're allowing you to see them in a bad state. That means that they trust you enough. And that's a good time for you to take that moment and allow them to feel a little bit better, to be comforted, to get some hands-on treatment, to just have their confidence boosted, right? So you're always, as a provider, going to be consistent with them. You're always going to be positive when you can be and create a hopeful situation, right? So these are great situations where you can try to build not only rapport, consistency, but be able to help their mental health state by just giving them that little confidence boost, allowing them to laugh a little bit, vent a little bit, whatever it is they need. But you're always going to be consistent and positive, right? And that's going to create a very safe zone for these people. All right, the other thing you need to remember is that their needs may be different. There are going to be days where they come in and they're feeling really sensitive. And whether that's emotional or physical or both, because we know that the mind and the body are actually kind of connected, this is important to keep in mind. So if a patient comes in and they express to you that they're feeling very sensitive, it's not a good day to totally change their exercise program. It's not a great day to do a lot of aggressive work that you've never done before. This might be a good day to keep things consistent and stable and express to the patient that you're going to do the same things you've done before in order to keep them on the same path of progression and just make sure they get through this episode. So making sure that you're consistent and really listening to patients, because a lot of patients with mental health problems have become far more attuned to themselves than other people. So if you listen to them, they often are able to give you more information that is specific in terms of their body and their mental state and how it's going to react. So be sure you listen to some of those cues, because patients will give them to you. The other side of it is, remember to always remind patients how much better they're going to feel holistically if they can get up and move, right? We have this magical profession that kind of revolves around movement and exercise. And even though exercise isn't always that specific, when we can get people moving, we know from research that it balances out mood, it helps with happiness, it helps with consistency, it helps with general overall health and feelings of confidence. So if you can remind your patients about that, and remind them that even on days where they are having depressive episodes or they're extra anxious and don't want to leave the house, these are really, really important days to tell them it's good to get in a walk. It's good to do your PT exercises on the floor. It's great to make sure you get some stretching in, because that will help your body to feel better. Additionally, when patients have stuff they can do, it gives them an element of control, right? And when you have a mental health issue, you often feel out of control of your body and your mind and your affect. So giving patients things they can do to feel more in control is very helpful, and especially if we can help boost their kind of thought process around that, about being able to be in control, then they can have an understanding of one thing that they can try. as an affect to kind of change how their mental health is in that moment. So with that, and with kind of that safety and stability, you have to remember that sometimes patients need that as much as they need PT as well. I have a patient right now who came to me and told me his life story, and literally in the last year has developed a severe extent of anxiety. Now, it's really, really important to keep in mind that anxiety and chronic pain and affects and kind of sensitivity of the nervous system all play into effect at the same time. So remembering with these patients to be able to talk to them with positivity and hope is a key element. For this patient in particular, he has come in with a new problem each time. And each time we kind of talk through those problems and we can get them to go away within a session. Now, one of the things we're working on is being able to take those ideas about pain and change them, and that kind of reverberates within him, and he's starting to come in and actually understand how much his anxiety is linked to some of his symptoms. But he's also then becoming more in control of his pain, because when he can link some of those things together, he can start to work on some of the things that decrease his anxiety in order to control his pain versus thinking, oh shit, I'm injured. So really being able to link that stuff together for people and give them that safe space to figure out where the biggest bang for their buck is can be really helpful as well. Now, the other side of this is to remember that as PTs, we are not licensed mental health care providers. When you have a patient who really, really needs a counselor or professional help, you need to reach out, right? Like, don't go to a level where you don't feel comfortable treating because it's outside of your scope. This is where we need to reach out to our coworkers. We need to look for local resources. It's really important to find a counselor in town or a psychologist that you trust and know and can refer patients to, because there are going to be people who really need to talk to you or to someone for an hour, maybe 2 hours a week in order to sort of get a handle on what's going on in their life or to express some of the things or the trauma around an incident, whatever it is. So it's important to create that relationship within your community so that you can refer these patients and then allow your time to be spent with them working on their physical therapy aspect. So making sure you have that referral point in town is really key. And it's also good because it shows your patient that you're invested in them and that you're not trying to take on too much and you're trying to get them the help they need without getting rid of them. You're not trying to pass them off. You're just trying to make sure that they're getting all the resources that they can benefit from. So guys, those are some tips in terms of treating patients with mental illnesses. Just remember, keep it positive, be hopeful, be silly, have a good time, and remember that these guys are people too. All right, everybody, have a freaking great day.